10 reasons you might have lower sexual stamina. A comprehensive look feeling like your sexual stamina isn't what it used to be. It's a common concern, and understanding the underlying causes is the first step toward addressing them. Sexual stamina is a complex interplay of physical, emotional, and psychological factors. When one or more of these areas are out of balance, it can significantly impact your ability to engage in and enjoy intimate moments for extended periods. Let's delve into 10 key reasons that might be contributing to a decline in your sexual stamina. 1. Stress and anxiety. The silent stamina saboteurs your mental state, profoundly influences your physical performance. High levels of stress and anxiety trigger physiological responses that directly undermine your staying power. Diverted energy. Stress activates fight or flight, redirecting energy and blood flow away from sexual arousal and performance towards survival functions. Hormonal havoc. Chronic stress increases cortisol, which can suppress sex hormones like testosterone, making arousal and stamina difficult. Vasoconstriction. Anxiety constricts blood vessels, reducing crucial blood flow for erections in men and engorgement. Lubrication in women, impeding physical responses. Mental distraction. Racing thoughts about worries or performance during intimacy pull you out of the moment. Hindering arousal and duration. Fatigue. Continuous stress is draining, leading to profound exhaustion that leaves no reserves for maintaining sexual stamina. 2. Relationship problems. When connection fades, so can stamina. Sexual intimacy is deeply intertwined with emotional connection. When a relationship is strained, it can significantly impact sexual desire, arousal, and endurance. Emotional disconnect. Lack of intimacy or understanding with your partner dampens sexual desire and the comfort needed for sustained activity. Unresolved conflict and resentment. Ongoing issues create a hostile emotional environment, making it difficult to relax and engage sexually. Poor communication. Inability to discuss sexual desires or concerns leads to frustration, making intimacy feel unfulfilling and impacting stamina. Lack of trust. Eroded trust creates a barrier to vulnerability. Intimacy and relaxation, all essential for sustained sexual engagement. Mismatched libido's desire discrepancy. Significant differences in sexual desire, if not openly managed, can lead to frustration and pressure, affecting stamina. Performance pressure within the relationship. Past difficulties due to relationship issues can create performance anxiety, draining stamina and subsequent encounters. 3. Depression. The heavy weight that can douse the spark. Depression is a complex mood disorder that profoundly affects how you think, feel, and behave, often leading to a pervasive lack of interest and energy, contributing to reduced sexual stamina. Profound energy depletion. Overwhelming fatigue, a core symptom, leaves insufficient physical or mental reserves for sexual activity. Reduced libido and interest. Depression strips away interest in pleasurable activities, including sex, making initiation and sustained focus difficult. Anhedonia. The inability to experience pleasure directly impacts the sexual experience, making it feel less rewarding and reducing motivation for sustained activity. Negative self-perception. Feelings of worthlessness or poor body image create psychological barriers hindering sexual engagement. Sleep disturbances. Disrupted sleep patterns contribute to overall fatigue, directly impacting stamina. Impact on neurotransmitters. Imbalances in brain chemicals vital for mood and pleasure also impair physiological sexual response. Medication side effects. Some antidepressants can cause decreased libido, difficulty achieving orgasm, and reduced stamina, creating a challenging cycle. 4. Performance anxiety. The fear that can trip you up performance. Anxiety in a sexual context is a common and often debilitating issue where individuals experience significant worry or fear about their ability to perform adequately, often becoming a self-fulfilling prophecy, a fight-or-flight response. Anxiety activates this response, diverting blood flow from sexual arousal to large muscle groups, hindering readiness. Impaired arousal and blood flow. Vasoconstrictive effects impede Vital blood flow for erections and engorgement. Lubrication. Making sustained physical readiness difficult. Mental distraction and self-monitoring. Worrying about performance consumes the mind, preventing presence and relaxation needed to sustain natural physiological responses. Increased muscle tension. Anxiety leads to general muscle tension, including pelvic floor muscles, interfering with smooth functioning, comfort, and duration. Preemptive shutdown. Overwhelming fear can cause the body to prematurely lose arousal as a protective mechanism, ending activity. Cycle of fear and avoidance. Negative experiences fuel more anxiety, creating a vicious cycle that can lead to avoiding sexual situations. 5. Low testosterone. The hormone hurdle to staying power. Testosterone is crucial for sexual health and overall well-being in both men and women. When levels drop below optimal ranges, it significantly impacts sexual stamina. Decreased libido, a primary symptom. Reduced sex drive makes initiation difficult and maintaining arousal challenging. Reduced energy and increased fatigue. Low T often causes chronic fatigue and lack of vigor, leaving insufficient reserves for sustained physical activity like sex. Impaired erections. Testosterone is vital for nitric oxide production, impacting blood flow to the penis. Low levels make achieving or sustaining erections harder. Loss of muscle mass and strength. Lower testosterone can decrease overall physical strength and endurance, indirectly affecting sexual stamina. Mood changes and depression. Low testosterone can contribute to mood swings and depression symptoms, further impacting energy, desire, and pleasure. Who is affected? Men, common with age, but can affect any age due to medical conditions or lifestyle. Women, while levels are lower, extremely low testosterone can also reduce sexual desire and cause general fatigue. 6. Medications. Unintended side effects on your sexual stamina. Many medications, while treating specific conditions, can have unintended side effects on sexual function and stamina, ranging from decreased libido to direct endurance issues. Never stop prescribed medication without consulting your doctor. Antidepressants can significantly reduce libido, make orgasm difficult, and diminish capacity for sustained activity by altering neurotransmitter levels. Blood pressure medications, beta blockers, and diuretics can reduce blood flow to genitals and cause fatigue, impacting stamina and erection quality. Antihistamines. Older antihistamines can cause sedation and dryness, affecting lubrication and overall sexual responsiveness. Opioid pain relievers. Long-term use can suppress testosterone production, leading to decreased libido and energy. Finasteride can lead to reduced libido and erectile dysfunction by blocking testosterone conversion. Benzodiazepines can suppress the central nervous system, reducing libido and dulling sexual response. Certain prostate medications can affect ejaculation and overall sexual function. Chemotherapy and hormone therapies often have significant side effects on sexual function and stamina due to altered hormone levels. 7. Medical conditions. When your body is battling bigger issues, underlying physical medical conditions profoundly affect sexual stamina by impacting the cardiovascular system, nervous system, or overall energy levels. Cardiovascular diseases. Conditions like heart disease, high blood pressure, and atherosclerosis restrict blood flow to the genitals, hindering erections and engorgement. Lubrication. Diabetes. Uncontrolled high blood sugar damages nerves and blood vessels, leading to erectile dysfunction, reduced sensation, vaginal dryness, and fatigue. Obesity. Linked to various conditions, obesity reduces energy, causes physical discomfort, and impacts hormone levels, diminishing stamina. Neurological disorders. Conditions affecting the nervous system interfere with nerve signals, impairing sensation, arousal, and physical responses needed for sustained activity. Kidney disease can cause fatigue, anemia, nerve damage, and hormonal imbalances, severely depressing libido and stamina. Liver disease. Chronic liver conditions disrupt hormone metabolism, affecting sexual desire and function, with fatigue as a prominent symptom. Thyroid disorders. Imbalances cause significant fluctuations in energy, metabolism, and hormone balance, directly impairing stamina. chronic pain conditions. Constant physical and emotional drain from pain reduces libido and energy, making sustained sexual activity difficult. Sleep apnea causes poor sleep quality and chronic fatigue. It's often linked to lower testosterone, directly diminishing sexual energy and stamina. 8. Age. The natural evolution of your sexual stamina as we age. Natural physiological changes occur that can influence sexual stamina due to hormonal shifts, altered blood flow, and overall energy levels. Hormonal changes. Gradual decline in testosterone or drop in estrogen affects libido, energy, and physical responsiveness. Reduced blood flow and vascular health. Less elastic blood vessels and plaque buildup impede circulation, making arousal slower and harder to maintain. Changes in nerve sensitivity. Decreased nerve sensitivity in genital areas can mean less intense sensations, potentially shortening activity duration, overall energy levels, and fatigue. A general decrease in energy and longer recovery times, naturally lower capacity for sustained physical activity. Increased likelihood of other medical conditions. Age increases risk for conditions like heart disease and diabetes, which independently impact stamina. Muscle and joint aches. Increased discomfort from aches and conditions like arthritis can make certain positions uncomfortable, reducing ease and desire for prolonged activity. 9. Poor physical health. The cumulative toll on your stamina. Poor physical health refers to a general state of being out of condition, lacking vitality, and struggling with basic functions, directly impacting stamina. General deconditioning and lack of fitness. Inactivity leads to inefficient cardiovascular function, weakened muscles, and plummeted endurance, making sustained sexual activity difficult. Chronic fatigue. An unhealthy lifestyle can cause pervasive fatigue, leaving minimal energy reserves for sexual activity. Suboptimal circulation. Less efficient blood circulation compromises blood flow to genitals, impacting readiness and stamina. Systemic inflammation and poor recovery. Low grade. Inflammation and slow recovery from exertion leave fewer resources for sexual energy and pleasure. Impact on body image and confidence. A decline in physical health can lead to self-consciousness and anxiety during intimacy, creating psychological barriers. Breathing and respiratory function. Compromised lung capacity or inefficient breathing can lead to quick breathlessness during exertion, cutting short intimacy. 10. Fatigue. The simple yet profound energy drain. Fatigue is a pervasive sense of exhaustion and reduced mental physical capacity. While a symptom of other issues, it's a direct and powerful reason why sexual stamina might be low. Zero energy reserves. Depleted energy reserves mean you too tired to initiate sex or quickly run out of steam during activity. Reduced libido and arousal. Fatigue heavily impacts mental energy and desire, making it hard to get aroused or stay present. Impaired physical responses, compromised muscle tone, less efficient blood flow, and reduced endurance make sustained physical engagement difficult. Difficulty concentrating and being present. An exhausted mind struggles to focus and connect, making the sexual experience less fulfilling and harder to sustain. Slower recovery. Fatigue means physical exertion takes a greater toll, leading to slower recovery and less inclination for future intimacy. If you're experiencing a persistent decline in sexual stamina, especially if accompanied by other new or worsening symptoms, it is highly recommended to consult a healthcare professional. They can help identify the root cause and guide you toward appropriate solutions.